Hey everyone, this is Rick MacDermid here with Senior Solutions Group, and we help retirees and pre-retirees plan for Medicare and retirement. Thanks for taking the time to watch this video, and if you haven't done so already and you would like to, please subscribe to our channel. So I got back from Austin, Texas, from the National Association of Health Underwriters National Conference last week, and learned a lot. We had a fire hose of information coming our way, and I want to kind of give you a quick update on one of the things that we learned, and we'll go from there. So one of the keynote speakers at the conference was Dr. Marty Makary, who wrote the book The Price We Pay, which I read in just a few days. Actually, I could have read it in one day, but I didn't have time to read it in one day. But I read this book, and oh my gosh, this book lifts the veil. He is a New York Times best-selling author and a cancer surgeon, a pancreatic cancer surgeon at the prestigious Johns Hopkins Hospital in Baltimore, Maryland. So he's toured the country. He's toured the country to learn about our healthcare system and what broke it. One of the stories he talks about in his book, The Price We Pay, and I highly suggest that you get this book and read this book. I can't stress enough how much I learned from this book. He went to a hospital in New Mexico, in Carlsbad, where the Carlsbad Caverns are, the national park, not too far from the town of Carlsbad, New Mexico. The town itself is about 24,000 people. And he heard that the hospital was suing people left and right. So he went to investigate himself. He went to the courthouse, and the courthouse employee at the front desk of the clerk's office, where he was going to check on these lawsuits because it's public record, she was all tense and it's like, well, what are you doing here? What do you want? What are you trying to find? And he said, well, I heard that the hospital's suing people in this town, and I'm a doctor and I'm trying to investigate what's going on. And she untensed as soon as he said that, and she said, oh, they're suing me. And she led him back to the room where he could collect the information on all these lawsuits. And one by one, courthouse employees started to gather and figure out what was happening. Oh, they're suing me. Well, they're suing me too. They're suing me too. So he's finding out how this hospital is suing these people that are honest, hardworking Americans, people that work at Walmart, at these Lowe's, Home Depot type places, people that are making maybe $18 an hour. These middle income, lower income people that are getting sued by this hospital in the town, where people are feeling hopeless, so much so that they're driving an hour and 20 minutes away, 75 miles south, to Roswell's hospital, Roswell, New Mexico, where they're not suing their patients. Something's broke in America if a hospital is suing half the town. So in this book, he documents this. He documents how he was able to get these lawsuits dropped, help these patients, and find out where there's systemic price gouging in American healthcare, whether it's medevac companies that are buying the hospitals, helicopters, buying out all the airplanes from the hospitals. These medevac companies there were just a handful of them in the 80s. Now in the last 20-some, 30 years, there's over 1,000 medevac companies. Why? Because it's a big, big business. So that is discussed in this book as well. The great thing about this book is there is hope. Dr. Makary is finding hope. He found a hospital in Nebraska that's doing the exact opposite of what the hospital in New Mexico was doing, where they're actually taking a holistic approach to caring for their patients. So instead of treating the symptoms of diabetes, let's treat the whole person. How can you eat better? Let's find a place where you can exercise on premises, and let's charge you what we get paid, roughly what Medicare pays us. We don't have to charge you 10 times the Medicare rate. A lot of these doctors were unaware that this was happening in the book. Dr. Makary talks about this. So there's like a wall of separation between the clinical part of the hospital and the business side of the hospital. Those walls are starting to crash down and crumble, folks. Hospitals now have to be more transparent with their pricing. So imagine this, and this example was used in the book. What if you went and mowed someone's lawn for 30 minutes and you charged them $8,000? Well, the judge that Dr. Makary was talking to said, well, I wouldn't pay it because there's no contract. So one of the things you need to be aware of when you go to a hospital and you sign that form, you are agreeing to pay whatever the price may be without knowing ahead of time. Imagine if airlines did this. So instead of publishing their price, you found out what the price was after you took the flight. They could charge you whatever they wanted to charge you. Something's wrong. The tide is starting to turn. We help our clients on Medicare try to find the best plan possible. The problem is a lot of these doctors, primary care doctors especially, don't want to take Medicare because they're making so much less money from Medicare patients than they are from people on regular health insurance. Why is that? Why is there two separate Americas? Why do people on Medicare pay a different rate for their care than people that are on traditional employer health insurance? All the middleman, the crony capitalism in America with healthcare, it's not a Republican issue, it's not a Democrat issue, it's not a conservative or a liberal divide. It's a widespread sentiment that all Americans feel, and we all need to take action. You need to read the book, The Price We Pay, educate yourself, and at the local level, talk to your doctors, talk to your hospital administrators. We can fix this, folks. We are all in this together. We are not powerless, and that's one thing that this book talks about. We are advocates for people on Medicare, because people on Medicare are struggling with higher gas prices, higher food prices. Their Medicare supplement premiums just went up in our state. One of the carriers went up 15% recently with one of their plans. We're calling all of our clients on that plan and saying, hey, there's a less expensive option without reducing your benefits. So we're on the front lines. So we're keeping ourselves abreast of all the developments we can possibly. That's why I take the time to spend my own hard-earned money to fly down to Austin, Texas to learn about these things. That's why I'm a member of the National Association of Health Underwriters. We fight on your behalf in Washington to have private solutions to healthcare costs. And we are here for you at Senior Solutions Group. If you know someone that's getting ready to turn 65, or if you yourself are needing help with Medicare or any retirement solution, reach out to us at seniorsolutions.net. Subscribe to our channel, share this video with a friend. We are here for you, and thanks for taking the time to check out this video. And by the way, we'll have links to Dr. Makary's C-SPAN interview down below. Thanks so much.